start with that. Clearly what we are now working alongside are our colleagues from the Counter-Terrorism Network. They are hugely competent. I have every degree of confidence in their professionalism and their ability to understand the chronology of events. At this stage, it's far too early for us to go into any further information and detail, but the chronology of events is clearly a key line of inquiry for our colleagues within the Counter-Terrorism Network. Alistair, did you have anything further?
Not to add to that, I think.
Excuse me, can I just follow that up, please? Does that mean that you're now expanding the search area, decontamination sites with this new discovery?
I think what we've been clear with saying so far is based upon the areas that we think are new to patients have been to, we have operated within the best scientific and public health advice to be able to identify those locations and put some control around those. So that's why we are now seeing several of the areas in both Salisbury and Amesbury that are under protective guard, under the control of the Counter-Terrorism Network, but supported by Wiltshire Police.
And to clean those sites in the same way that the sites were cleaned and decontaminated after the Skripals?
Yes. We are still in the response phase of the major incident. We are working closely alongside colleagues from Wiltshire Local Authority who will be leading the recovery phase, and clearly the decontamination aspect of the major incident would fall under the remit of the recovery group. Alistair? Yeah. Investigation is clearly looking to identify the source of the contaminant. So further information.
At this stage we can say that you've not identified it or found it.
I think that they are questions that would be best raised with the Counter-Terrorism Network. At this stage we have controlled the areas and we are allowing the Counter-Terrorism Network to continue with their investigation.
Along that line, have you found the sites that you're looking at, have you found the site where the two were contaminated?
Similar to the last response, we have identified the areas where we think the two patients who have now fallen gravely ill visited prior to their decline in health. Our responsibility was to, alongside the public health support and the scientific support, identify those locations, control those locations, and enable now the Counter-Terrorism Network to systematically work through those things. The hypothesis that I described was one that related to a potential contaminated source of illegal drugs, illicit drugs, potentially cocaine or heroin. Based upon the advice that we were given from the clinician at the hospital following the admission of patients, based upon the information provided by the associates and friends of the two patients, and the details of substances, paraphernalia that was found inside the location, which of course I do not want to go into, the working hypothesis from the officers at that time was that they were dealing with a potential contaminated source of illicit drug.
And that's usual for them to be wearing hazmat suits to recover then?
I don't believe the police officers were wearing hazmat suits at that stage.
Was the container used to deliver the Novichok in the original attack ever discovered?
Again, that's information that would be with the Counter-Terrorism Network. It's clearly part of their inquiry to try to establish the entire chronology of the first incident and to draw any comparisons, if there are any comparisons to this latest incident. So that again is information that will be resting with the Counter-Terrorism Network. So,
can you be confident there's no more Novichok out there in Salisbury and the surrounding areas, or may we never know that?
Well, I think we've heard that we have based the response phase and the recovery phase based on the very best information, intelligence and advice that we've been given from our colleagues at Public Health and our science information. That has enabled us to control a number of our locations, some of which are still under the control of police, DEFRA and other colleagues working through the recovery centre. So we can only operate with the information that we have available to us. So thank you. As I said in my statement, there is a huge degree of anxiety. I understand that, but again, what I'd like to do is to reassure all of the community that we are working collaboratively across our partnership with our colleagues from the Counter-Terrorism Network to understand the situation and be able to return our great communities of Salisbury and Amesbury back to a position of normality. As soon as we're in a position to provide further updates, both in terms of the investigation and other aspects that are ongoing in this incident, we will do that, of course. So, ladies and gentlemen, thank you for your time.